pregnancy tips. I'm going to be answering some questions on how to get pregnant fast and some questions that I've been seeing on the comment section. The last one was, how long would you stay after having sex so that the sperm can go in? Some say they're seeing after sex, they stand up, they see the sperm flush out, doesn't mean they are infertile and all. And I will be giving you about 10 things to do, even to your husband, because most at times we're doing some things wrong that will alter the process of conception, because it takes a day for you to get pregnant for this whole thing to happen. So if you miss the chance, before that, please, I hope you know that there are 3 ways that God answers our prayers. Number 1, when you pray, he gives you what you want. Secondly, he doesn't give you, he just keeps news, like he says, wait, it's not yet time. Or he says he doesn't give you that thing because that thing is not good for you, or that thing may destroy you. Please have this in mind. I know you will say, how can God not give somebody a child? There is always a reason for everything. There is always a reason. I don't want to tell you a story. If not, I would have told you to not elongate this video. So however you're asking, you keep praying, keep trusting on God, but don't ask him questions. He knows the best for you. So let's get to it. Now, there's been a myth that after sex, you should, lie down for 30 minutes and all. Well, that it helps increase the chances of, conceiving. Well, you should, after sex, at least, lie down a little, maybe 2 to 5 minutes, because it takes actually for the sperm, because there are so many, sperm, for the sperm to get to the egg, it takes like maybe approximately 5 minutes, 5 to 8 minutes approximately. So you can just relax. But it's actually a myth, because the sperm swims fast. Then secondly, for the issue of standing up and you're seeing things like a sperm coming out, well, this is semen mixed with your cervical fluid. It's actually normal. There's nothing wrong with it. Usually this takes about 30 minutes. If you stand up, you see with the pressure, you see it. This is normal, okay? I've made an explicit video about this, so you can actually locate that video. Now, let's get to the things that will actually help you. Now, for the men, your husband should try not to overheat his testes, okay? Stop wearing tight boxers, sitting on a bike for a very long time. Anything that will make your testes hot, it reduces the sperm amount, motility and all. Then the kind of lubricants you use, there are certain lubricants that affect the sperm quality. It actually affects the sperm motility and all. I would have mentioned some, but when you're going to the pharmacist to get a lubricant, let them know that you want the one that is sperm friendly. The normal one that that is something jelly, it's not really sperm friendly. Now, also avoid to use spit, your saliva to wet that area. It reduces the sperm motility. Now, if you are an alcoholic, your husband is an alcoholic, or you guys take alcohol, this is the best time to reduce. Smoking, this is the best time to stop. Then, very important, your husband should go for sperm analysis. Go for sperm analysis. Don't think that you've, impregnated somebody before. As you age, your sperm decreases, okay? So go for semen analysis, find out that if everything is low, is good. I think I have a video on sperm issues on my YouTube page, so you can locate the video there. So you yourself go to a fertility doctor, find out if anything is wrong, if your hormones are okay, everything is okay with you. If you are actually ovulating, most people are not actually ovulating, okay? Make sure that you are ovulating. If you don't know what ovulation is, I have a video on signs of ovulation on my YouTube page, how to know you're ovulating and how to calculate your ovulation. And it's not about having sex. Make sure you have sex at the right time when you're ovulating, 2-3 days before your ovulation and at the actual day that you're ovulating, okay? Then this is the most important of them all. Men should also learn to romance their wives, okay? Romancing your wife actually helps dilute the cervical fluid, okay? Because most women's vagina are acidic. So when the sperm enters, it kills it fast. So try to, romance your wife so that she will be wet and dilute the acidity of the vagina, so that when the sperm goes in, it will just go in, and not all of them will die. Some will actually survive to get to where the egg is. So opening in and closing in is not actually good, not only for because you just feel that you want to get her pregnant, you just enter and then you come out. This is very, very wrong. It will really reduce your chances of reduce her make the sperm not to last so long, especially for those that have so much acidic vagina, because naturally the vagina is acidic. So you just need to lubricate her by making her wet, romance her. It will go a long way. Okay. Now, for the ladies, you try to take some supplements. There are some supplements you're supposed to be on. For instance, vitamin E, vitamin C, folic acid. You have to take some supplements that will help prepare the egg. And if you are having polycystic ovarian syndrome, locate the video here too on PCOS and how to deal with it. It's actually 2 videos. There's one that I did with a gynecologist. That one will explain a lot for you. Okay, so reduce stress. Have sex because you want to have sex. Enjoy sex with your husband. Anxiety is one thing that will prevent you from being pregnant. Anxiety is one thing. It has a lot. I've worked with fertility nurses and I've seen it happen. Anxiety will, reduce your chances. So have sex with your husband. Enjoy sex for the purpose of, enjoying sex. And at the same time, while you're tracking your ovulation and when to ovulate. Now, if you're looking to have a male child, female child, twin pregnancy, I have a video each on them. So locate that video. Now, you have to be mindful on the types of drugs that you take. Please, even both for the male, both for the female, reduce the way you take analgesics, anti-inflammatory drugs. It has an impact on your fertility. All these things, you can just research them. I'm not just saying. It has an impact on your fertility. So please be careful on the kind of drugs you take. Even marijuana, tramadol, drugs, all these drugs. Most men especially use some of these drugs to satisfy their wife. I hope you know. And then you're hoping to, impregnate her. Please be aware that this drug has effect on your fertility. Even for her too. It also has effect on the female's fertility. So just be careful on the drugs that you are in. They're very important. Make sure you treat your infections. Most women actually have infections and they don't know, or they don't treat it. They keep on taking all these herbs that they sell online. And before you know it, this infection causes serious damage to their female organs. Okay. For instance, pelvic inflammatory disease. I have a video on that, on how to treat it. Other types of infections that you're having, how to treat infections. Locate the video here. They are different. PID is different. Yeast infection is different. Then how to treat infection. These videos are different. Locate it. So try to treat your infections. It can impair you and impede you from becoming pregnant even in the future. And it will cause irreversible damage that your fallopian tubes may become blocked and all. And then for the male, a male can have infection for months without signs, without knowing. Unlike the female that will just have infections today and she starts itching and all. So I think you should go for check yourself if you have infections. If there's an infection, you can check if you have infections, syphilis and all. Okay, gonorrhea, all of those things. They actually tests you can check. Go to the hospital, tell them you want to check for STI infections, and they will check you and find out if you're okay and if your reproductive organs is okay. And if you have infection, you treat it. Yeast infection, you treat it. And try to prevent yourself from having infection by practicing safe sex on yeast infection, on urinary tract infections. I have a video on how to prevent it from reoccurring and how to treat it. Locate all of these videos here on my YouTube page, and it will really go a long way to you, for you. So this is all for now. If you have more questions, you want to speak to a gynecologist, chat me on my Instagram page. I will refer you to one. My name is Nurse Merit and I'm a nephrology nurse. I hope this video has blessed you. Like, share, and follow for more. Make sure you like and hit on the subscribe button if this is your first time.